Hello, my name is Jody Thomas. I'm here to increase your understanding of the importance of good oral health care. There are very serious consequences that are unknown to people outside of the dental community. Poor oral health is very serious and the consequences can be deadly. It is very important that people are made aware of the dangers of not keeping good oral health. There are many ways to prevent poor oral health and the problems it leads to. I investigated doing research, and I've also been working in the dental field for almost 12 years. I will be discussing the details of my investigation and also my knowledge with oral health. I would like to first take some time to discuss the consequences of having poor oral health. One of the first signs of poor oral health is a cavity. A cavity is when there is decay in the enamel of the tooth. When there is plaque left on the teeth, the acid in the plaque will eat away at the enamel of the teeth. The cavity starts by poor oral hygiene or lack of having oral health care. Another result of poor oral health care, according to Dr. Ramaya Goff, is gum disease. Gum disease is when there is swelling, soreness, and bleeding of the soft tissue and gum around the teeth. It is caused by the bacteria in the plaque. It is a sticky, clear substance that forms over the teeth. Gum disease is the primary cause of tooth loss in adults 35 and older, according to American Academy of Periodontology. According to research from Colgate, there are 4 stages of gum disease. The initial stage is gingivitis. Gingivitis is caused also by the plaque, the bacteria in the plaque, and it is reversible. There is slight bleeding and redness in gingivitis. The next stage of gum disease is more severe than gingivitis. It is referred to as early periodontitis. In this stage, the inflammation progresses into the supporting structures of the teeth. The gums will continue to bleed, and there is going to be some bone loss, which will result in pockets between the teeth that separate the gum and the tooth. The third stage, even more severe, is known as moderate periodontitis. In this stage, the inflammation will start to get so bad that the destruction and breaking down of the supporting structure will cause the teeth to become mobile. There will start to be more noticeable bone loss and some tooth movement. The fourth and final stage of gum disease, according to Colgate's research, is known as advanced periodontitis. In this stage, it is irreversible. You cannot change it. The bone loss and tooth mobility will increase dramatically. Eventually, you will have loss of 1 or more teeth. The most unknown and relevant cause of poor health care is death. One of the most serious diseases in the mouth is oral cancer. It is a major cause of death and disfigurement in the United States, according to the National Cancer Institute. If oral health care is not maintained, the infection from the teeth and mouth get into the bloodstream. The infection can go to your heart, causing a stroke or even death. The National Institute of Dental and Craniofacial Research found that approximately 80% of American adults have some form of periodontal disease, and the majority of them don't even know that they have it. Now that I have let you in on the possibilities that it can occur from not taking the precautions to avoid poor oral health, I would like to also tell you some ways to prevent it. Poor oral health care can be prevented if you follow a few guidelines. Do not smoke cigarettes or use tobacco. If you brush with a soft bristle toothbrush at least 2 times a day, floss in between the teeth at least once every day, and make sure to get regular professional dental cleanings at least twice a year. Now let's review. Everyone has the ability to prevent poor oral health by brushing and flossing regularly. The consequences of poor oral health may be moderate at first, but can turn deadly in an instant. The consequences of poor oral health may be moderate at first, but can turn in an instant. Give yourself a second to think. Do you know if you have poor oral health care? I hope after everyone leaves, they have a better understanding in the importance of oral health care and how to maintain it. Thank you.